Hello everyone, today we're going to talk about dental implants. Have you lost a tooth and the resulting gap is affecting the structure of your face and smile? Certainly you have heard about dental implants, which is the subject of our discussion today. Dental implant surgery involves the replacement of tooth roots with metal, screw-like posts and the replacement of damaged or missing tooth with artificial teeth that appear and function similar to natural teeth. Dental implants are fast becoming the new standard in tooth replacement because they fit, feel, and operate like natural tooth. In this video, we'll go over everything we need to know about dental implants, including indications, type of dental implants, and how this surgical procedure is done. Our role today is to answer most of your questions regarding dental implants. Today, we have Dr. Yim, who is a leading doctor at Sinshon Dain Dental Hospital. He's going to discuss with us everything related to dental implants from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases. Hello, Dr. Yim, how are you?
Yes, hello.
Also, can you introduce yourself to our audience?
I am Ying Hung Bin, Director of Dain Dental Hospital in Sinchon.
So for our first question, what is actually a dental implant?
In some cases, there are congenital cases, and there are cases where teeth are extracted due to accidents or cavities. In that case, an artificial material made of titanium is placed in the gum bone and the shape of a tooth is formed on it. These surgeries are called dental implants, which play an aesthetic and functional role in teeth.
So what are the advantages and disadvantages of dental implants?
Let me talk about the functional part first. When natural teeth function with 100% power, dentures can be considered to have about 30% power, and implants can be considered to have about 80% power. Therefore, the advantage is that the implants have the power to replace teeth almost as they are. Another advantage is that there is no bridge treatment. Surgery to plant one tooth on the spot when one tooth was missing began in 1982 for the first time. When the surgery was first performed, a bridge operation was performed to replace the missing tooth and connect both sides of the missing tooth. In other words, surgery was performed to grind healthy teeth to make bridges. But with the dental implant, surgery was performed with healthy teeth that were not damaged. Therefore, implants have the advantage of not damaging healthy teeth. Third, when an implant is planted in the gum bone, the implant constantly stimulates the gum bone. If there's no implant, gum bone will disappear since there's no support. So an implant prevents the gum bone from melting away. So there are three advantages. First, the implant has a strong force, which can almost replace the original tooth function. Second, new teeth can be completed without damaging healthy teeth located on both sides of the lost teeth. Third, it stimulates the gum bone to prevent loss of the gum bones. These are strengths of an implant. There's also a disadvantage. Implants are also surgery, so the process hurts, and it takes a certain period of time to proceed with the operation. The most standard protocol for implants is that you have to wait 3 months when you plant an implant in the lower part and 6 months when you plant an implant in the upper part. As soon as you plant an implant, you can't make a tooth and cover it, but you have to wait 3 to 6 months. In other words, it takes a long time, and it is expensive because it takes a long time. Therefore, the disadvantages are that it takes a long time, the process hurts, and the cost is high. However, despite such shortcomings, in dentistry, the first choice when the tooth falls out is an implant. Implant surgery is essential even if there are reasons such as patient's physical condition is not good. The patient is busy enough to have no time to undergo surgery or fear of surgery. Despite the shortcomings mentioned earlier, implants are now the top treatment method.
So what would happen if the patient does not do anything after removing their teeth?
There is a space inside the teeth. If you remove your teeth and leave them alone, both teeth collapse because there is no tooth to support them. Phenomena such as collapse on both sides and lowering of the upper teeth occur. Therefore, the tooth arrangement has collapsed. Second, if you leave the tooth removed as it is, the alveolar bone disappears. In other words, if the toothless state is maintained for a long time, other teeth move a lot, causing teeth arrangement to collapse. The alveolar bone to be absorbed, and the bone disappears. And bone transplantation has to occur when implanting. Therefore, when your teeth fall out, you need to replace them with implants as soon as possible.
So can you tell us about the steps of dental implants?
The first diagnosis should be made to get an implant. There are many diagnostic methods these days. The entire scan is performed through X-rays, panoramic views, CT, and osteoscanners. And based on such data, the overall treatment plan is diagnosed. When the treatment plan is diagnosed, the implant body is planted in the gum bone for the first time. First surgery is the process of covering the implant with gum flesh to keep the implant invisible and to put the implant into the bone to protect it from external environment. And after 3 to 6 months, a second surgery is performed to expose the implant to the outside. The last step is a step of making teeth. In other words, it is divided into the first stage of diagnosis, the second stage of planting implants, the third stage of exposing planted implants to the outside, and the fourth stage of crown stage of making teeth directly.
So in what cases can the patient get the same-day dental implants? Is it possible?
Dental implant is possible immediately after tooth extraction, if there is no inflammation at the end of the tooth root. If there's an inflammation at the end of the root, you have to wait 3 to 6 months for the inflammation to disappear. If there's no inflammation, that is, if there's a tooth extraction due to an accident or a cavity in the upper part of the tooth, the implant can proceed immediately. In addition, implants can be performed if there is no periodontitis. However, there are a wide variety of cases. Therefore, it is difficult to say that 100% implants are possible after extraction in the case of an A or a B. It varies from case to case of each patient. For example, if the patient is socially busy or has difficulty receiving treatment for a long time, implants may be performed immediately after extraction. Recently, since implant surgery has a high success rate, it is becoming increasingly common to proceed with implants immediately after extraction.
Okay, so just now you have mentioned the success rate. So what is the success rate of dental implants?
Dental implant success rate varies depending on the period of research conducted by each manufacturer or company. There are differences depending on whether the data collection period after treatment is 1 year, 5 years, or 10 years. Currently, the most reliable data are papers from 1965 to 1982. In this paper, after implantation was performed on 1,500 patients, treatment results were analyzed for a period of more than 10 years. As a result, the upper tooth has a success rate of 83%, and the lower tooth 92%. Therefore, as a result of a very long-term analysis, data showed that the implant results were stable. These days, implant products have also improved, showing a success rate of 90% to 95%. Some companies have a success rate of 98 to 100%. But these results are cases where the analysis period itself is not long. Therefore, from a long-term perspective, or more than 10 years, the implant success rate can be seen as about 95%.
So what is a surgical implant guide?
The implant surgical guide first appeared as a surgical aid for doctors undergoing implant surgery. Surgical guide came out as an instrument to measure the location and angle of implant planting. In the early 2000s, Sweden's Nobel Biocare linked it to CT and developed a guide system that enhances the convenience of surgery based on data analyzed through CT. Currently, this technology is developed a lot, and guide systems have been created by several companies and can be used more conveniently. But personally, I don't trust the guide system yet, because when diagnosing, the diagnosis is made through X-ray or CT, so the doctor must see it with his own eyes. An appropriate surgery should be performed to fit each patient's bone. However, this guide system can be diagnosed through X-ray and inserted in an appropriate position, but it is difficult to change due to the fixed insertion position and difficult to perform surgery that fits each patient's bone. Therefore, I think that experienced doctors can increase the success rate and increase the patient's satisfaction by seeing and operating with their own eyes rather than proceeding according to the guide.
In what cases that implant placement cannot be performed?
If you can't get an implant, first of all, there's an age problem. Adolescents who have not completed growth or men who are still growing late are recommended to implant after growth is completed. If you do an implant, the area will no longer grow, so it is a principle to do the implant after the overall growth is over. In general, implants are recommended only for adults over the age of 20. In other cases, dental implants are not operated in the case that patients have uncontrolled severe diabetes, take long-term osteoporosis treatments, suffer from mental illness, or receive chemotherapy. In this case, implants are not recommended. In most other cases, implants can be performed. These days, procedures are also simplified, so there are very few patients with non-adaptation.
So, how long does it take to have an actual crown after inserting the implant into our bones?
There is a period of time required before making a crown, after implantation. The implant is planted in the bone, and a period is required to stick the implant and the bone. Sweden's Dr. Brennimax said a period of 3 months for the lower teeth and the 6 months for the upper teeth need 3 months. Now, the period has been much reduced due to the development of implant surface technology. There are implant surgeries that can be performed in as short as 4 to 6 weeks, but generally require a period of 2 to 6 months. After the gum bone and implant surface are clearly attached for a sufficient period of time, a crown for making teeth should be made. Creating crowns may vary depending on the location or number of implants. These days, there are also procedures for implant prostheses within a week after implantation. However, it is not possible for the entire area, but there are some possible areas. When implanting, it is important to follow the basic principles from medical history and information known to date. Therefore, it is important to follow the basic principles and take turns in the process of making teeth without rushing to make a tooth too much. Teeth can be made 1 to 2 months earlier right now, but it is more important to make implants that can be used more robustly in the long run.
Doctor, so in what cases do patients need to get a bone grafting or sinus lift surgery?
After a certain period of time after tooth extraction, many bones around the teeth are absorbed, resulting in a lack of bones. In this case, bone grafting is required. In general, bone grafting is required in most cases. In particular, if the difficulty of surgery is high and the amount of bone grafting is required, maxillary bone grafting is performed. There's an empty space under both cheekbones, and this space is called sinus. This sinus itself serves to make the sound that rings when we talk and to reduce the weight of our head. It reduces the weight of the head by creating an empty space in the bones of the head, and also plays a role in warming the air when breathing. By having an empty space, it plays a role in strengthening the head structure. However, it is difficult to do implants because of this empty space. Therefore, when implanting, bone grafting is often performed in this space. Usually, as you get older, this sinus space grows bigger and larger. Let's take a look at this model. The red parts under the cheekbone are sinus. There's an empty space inside this. When putting an implant in this space, this empty space acts separately, so this part is lifted, bone transplanted, and implanted in this part. This surgery belongs to a highly difficult operation when implanting.
How long does a dental implant last normally?
How many years normally do you use when you buy a car?
한 20년 정도?
Okay, 20 years. I've seen people scrapping cars in less than a year.
맞아요.
After all, how to manage and maintain this implant is important. Implant life is generally about 10 to 15 years. It could be seen as similar to buying a car and using it for about 20 years. If you take good care of your teeth when eating or brushing your teeth, you can extend your implant life. On average, it can be seen that the implant is used for about 15 years. And if it is managed well, it can be used longer.
So what kind of follow-up care is necessary after getting a dental implant?
Post-management. These parts always have a fixed answer. To brush your teeth cleanly, visit the dentist regularly, and get scaling. It's something I always say to patients. The way I recommend for follow-up care is to use floss. It's a way to clean your teeth with water pick. This management method is to make the implant usable for a long time.
So can all dental implants be removed or replaced after some time?
Looking at the implant, this structure itself has a screw shape. In the past, it was not in the form of a screw, but in the form of a blade. It was a method of inserting it in the form of a blade according to the gum. The difference between this blade implant and the current screw type is whether or not the implant can be replanted. In the case of blade-type surgery, there are no bones left to replant the implant. However, this current implant structure is a structure in which bones can sprout back in place when stolen from the gums. Therefore, if there is a problem with the currently planted implant, the implant can be excreted, waiting for the bone to occur, and then the implant can be planted again. Currently, people's lifespan have been extended, so it is difficult to plant implants once and use them for a lifetime. Therefore, 10 to 20 years later, there are ways to remove the implants and plant new implants. The implant has a structure that can be pulled out later and planted again later.
So is dental implant surgery painful?
Surgery always hurts. It is a lie to say that the process of incision in the gums, grinding bones, and inserting implants does not hurt. But things like lies often happen. One of the things people misunderstand is that bone has a sense. There is no sense of pain in the bone. That's why you feel pain in your gums and flesh. You place an anesthetic injection on your gums well. You can plant implants without pain. This is because bones do not sense pain. Therefore, implant treatment is not as painful as people might imagine. However, when performing surgery, the surgical instrument is close to the ear, so the sound stimulates the hearing and feels more painful.
Okay, it still sounds painful. So what kind of anesthesia is used for this surgery?
In general, implants are performed with local anesthesia. General anesthesia is done very occasionally. Sleep anesthesia is performed on patients who are very sensitive to pain or patients with vomiting symptoms, and implants are performed. In our hospital, 70 to 80% and 20 to 30% of patients undergo local anesthesia are undergoing sleep anesthesia. And for female patients with severe fear of surgery, undergo surgery through sleep anesthesia.
Okay, so how long does a dental implant procedure take, and for the checkups, is this necessary after this procedure?
If you think about it simply, you'll be diagnosed by visiting the hospital. After that, when it is decided to do an implant, the implant surgery is performed, and then the thread is removed. And after monitoring the condition, 7 to 8 visits to the hospital are required for a second surgery to make a crown and a prosthesis. Therefore, you can think of it as 3 times as a primary operation, a secondary operation, and a prosthesis process. In the case of overseas patients, surgery and prosthetics are performed twice within 6 months.
Okay, thank you so much, Dr. Yim, for answering our question today. 감사합니다.
Thank you.
If you are self-conscious because you have missing teeth, wear dentures that are uncomfortable, or don't want to have a good tooth structure removed to make a bridge, talk to your dentist to see if dental implants are an option for you. Thank you for joining us once again today at Cloudsville TV. If you have any questions or comments, please leave them below and respond to you as soon as possible.